Hi, my name is Dr. Brent Forester. I am the Chief of the Division of Geriatric Psychiatry at McLean Hospital, an Associate Professor at Harvard Medical School in Psychiatry, and the Medical Director for the Behavioral Health Integration Program within primary care practices at Partners Healthcare. It's a pleasure speaking with you all today about ways we can keep our brains healthy during the time of this challenging pandemic. There are a couple of key principles to keep in mind. First of all, when we think about healthy brain aging, we focus on some key factors that are associated with cognitive decline in later life. Those factors include all of the risks for heart disease and stroke, such as high blood pressure, diabetes, high cholesterol, obesity, a sedentary lifestyle. We also think about depression and anxiety, as well as substance use disorders, all of which are modifiable risk factors for cognitive decline with advancing age. So even during the time of a pandemic, when we're socially distant from others, when we're socially isolated, when we're not as mobile as we normally are, where it's more challenging to exercise and to eat well, there are so many factors that we need to keep in mind that can still promote healthy brain aging. First of all is nutrition. When we're around our homes all day long, it may be tempting to go into the closet and pick up some unhealthy snacks, either because we're bored or we're interested in doing something to keep us awake. But it's important to remember key principles about nutrition that keep our brains healthy. The Mediterranean diet, for example, which is high in omega-3 fatty acids and low in saturated fats and relatively low in red meat, for example, really important to keep those principles in mind. And everything should be done in moderation. Ice cream here and there, of course, is fine, but not as your main meal all day long. And then there's, of course, exercise. Exercise is important for all of us at any age and really promotes healthy brain aging. For example, aerobic exercise, even walking for 30 minutes a day, 3 to 4 times a week, or other forms of aerobic exercise such as biking or running, or doing some basic yoga exercises and strength training, getting our heart rates up to maybe 60 or 70% of its maximum, 30 to 40 minutes, 3 to 4 times a week, is highly recommended to promote healthy brain aging. And then finally, social connections with other people, staying busy, maintaining a schedule. All of these things become so much more challenging during this COVID-19 pandemic. But it's still critical that we set some structure to our daily lives, that we try to surround ourselves with friends and family, even if it's via technology like Zoom or the phone. Staying in contact with those people that we love is so critical. It's just harder now, but we still need to do it. And then finally, keep in mind that everything that you do on a day-to-day basis should be done with some balance and perspective. Spending 10 hours straight at the computer working or even online is probably not healthy for our brains. Mixing it up with some walks outside, with some conversations with people on the phone, can really help to allay anxiety and stress during this very difficult time. The one last thing I'll mention as a psychiatrist is that stress and anxiety, we know, is a risk factor for developing Alzheimer's disease as we get older. And moderating stress during this time is particularly challenging. So it's really important that you all figure out ways that help to moderate your own stress. For some people, it's talking to friends or going for a walk. For others, it's doing deep breathing exercises or yoga or some other form of exercise. But whatever it may be, paying attention to your own physical and emotional symptoms of anxiety and stress is really important. And because of the increased use of telehealth and teletechnologies to connect with our own clinicians, our primary care physicians, etc., it's really important that we reach out for help if we're finding that we're not sleeping well, or we're not eating well, or our thoughts are negative, or we're feeling like hopeless and full of fear all the time. This too shall pass. This is going to be a challenging period of time in all of our lives, but there are many silver linings that will come out of this. And the more that we all can do to stay active, pay attention to nutrition, exercise, and new forms of social engagement, we'll be able to maintain our brains well throughout this pandemic and beyond. Thank you very much.